Good morning. If you have decided to study to become a professional hypnotherapist, keep watching our training videos about hypnosis. Hypnosis is a powerful technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also you will be able to download several ebooks also free. Let's see aspects to take into account in every therapy. The patients must see us as therapists, very sure of what we are doing. Therefore, we must reflect security in ourselves and in what we do. We must bear in mind that patients pick up on all this. When we are working on an exercise or visualization, we must take into account the law of displacement. If we see that our patient gets emotional and starts to cry in a certain exercise or visualization, we should not cut that image to free him or her from that emotion. In fact, we will let him or her go deeper into it and let him or her cry as much as he or she wants. We will always end the session with a gratification, injecting positive energy that will strengthen him. All of this will eliminate possible fears in the following sessions. In the visualization, we should avoid descriptions of what he or she sees and focus more on what he or she feels than what he or she visualizes. If at the beginning the patient cannot relive the situations in the first person, we will make them relive it in the third person. That is to say, they will see it like on a cinema screen, but we must not forget that later on, once the emotional charge has decreased, they will have to relive it in the first person. If necessary, we will use several sessions for this. We must formulate open questions, avoiding dictonymous answers of yes or not. For example, instead of saying, "Are you a woman?" we will say, "What are you?" We should also avoid giving the patient ready-made answers. Your father is happy and you, at the moment your sister is doing, you are going to see a very big and beautiful building, etc. The correct thing to say would be, we should also avoid giving the patient ready-made answers. Your father is happy and you, at the moment your sister is doing, you are going to see a very big and beautiful building, etc. The correct thing to say would be, how's your father at the moment? What is your sister doing? What does the building look like? And what does it feel like to see it? Try to avoid questions where the patient has to analyze things, as this appeals to the patient's consciousness, and the patient comes out of the trance state. For example, avoid the why. To place the patient in a certain place under hypnosis, it is convenient to use the 3, 2, 1 followed by the now. I am going to count from 3 to 1, and when I say 1, you will be in the location we want. 3, 2, 1, now. So much for locating, ordering, focusing, etc. If you are interested in learning more about clinical hypnosis, watch our next video, examples of phrases and questions that can be asked in aggressive therapy. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also you can download several free ebooks. If you have any questions, add them in the comments area. On this topic and many others we will talk about in the channel and in the videos that we will publish. So if you are interested, do not miss our next videos. Thank you very much.